Dr. Limongelli, when should a mom bring her young child to the dentist the first time, and what should be some of the things she really should take care of and make sure that it happens or doesn't happen?
Well, usually their first visit should be around 4 years old, and that's when I usually see the children, starting at 4 years old. And they don't really need much at that age. It just gets them used to coming to the dentist. We do cleaning and fluoride treatments and get them used to that. Of course, if they have cavities, if they're complaining of toothaches, then you can bring them at any age for those problems to be addressed. And usually for the very young children, the pedodontist is the best ones to treat them because those children need special care, and it's good not to have bad experiences at a very young age that can traumatize their ability to go to the dentist in the future. But usually at age 4, they tolerate procedures pretty well. They ask questions. We usually answer whatever questions they have. We do a cleaning, a fluoride treatment, check them for cavities, and we sort of ease them into the habit of coming to the dentist every 6 months.
That's great. Is there anything moms should know even before that, like not to worry when a child is teething, which I don't know when that is, or to do certain things or not to do certain things while this is all happening? Are there some advices you can give?
Yeah, teething, starts very soon after birth. First, the baby teeth come in. And then between 6 and 7 years old, they start to lose their baby teeth. The 6-year permanent molars start to come in. And between 6 and 7 years old, the front baby teeth start to fall out and the permanent ones come in. This is all a normal process. Probably the biggest thing that parents should know is not to let the child sleep with a milk bottle in their mouth or a bottle of sugar water. This really wipes out a whole set of baby teeth. I've seen children come in where there's nothing left of the baby teeth but roots. And it's mostly by keeping a bottle in their mouth and letting them go to sleep with it. You can't have all of that on the tooth surface during slumber. For the 6 or 7 hours that the child is asleep, either the sugar or the milk starts to produce an acid which causes rampant tooth decay. This is the most important thing. If they don't do that and they get the child into good oral hygiene habits, even brushing their teeth with their finger with a little toothpaste and rinsing their mouth out while they're very, very young before they can do it for themselves, it helps quite a bit.
Well, that makes sense, because after all, what good does it do to brush and then go and take a spoonful of sugar and keep it in your mouth the whole night, right?
That's exactly right. I have a lot of kids that, have siblings, brothers and sisters, and they're wondering, how come my brother doesn't have any cavities and he eats a lot more candy than I do? Most likely because his brother brushes his teeth before he goes to bed at night. That's the most important time to brush your teeth, to get all that sugar away from the tooth enamel. If you can do that, chances are you won't get tooth decay.
Well, that's probably why my wife doesn't have any, because, she spends a half an hour brushing at night, I do the
That's
showering,
the trick.
I do the showering, the shaving, I do everything, including the brushing, and then I talk to her 20 minutes while she's brushing. I think she brushes it away, that's what I think. But anyway, okay, now, is there anything a mom can do when the very young child, especially the 2-year-old or whatever, as they start teething, can do to reduce the pain a little bit and make the crying a little bit less? Make the child a little less, upset.
You can put a little Oragel. You can get it in the drugstore. A little Oragel on the gum tissue. It helps to ease the pain of the teething, and that's really what it's made for.
Okay. So it's basically a cooling type of thing, is that?
That's exactly right. It's sort of like a cooling mentholated gel that does help the teething pain quite a bit.
Okay. So
and makes the child more comfortable.
So when you notice that is happening, that the child is obviously teething and stuff, go and get some of that, and it will reduce it a little bit. And
Yep.
And talk to the child and tell them that is growing pain.
That's right. You know, I have a lot of patients that cut their wisdom teeth and have a lot of pain. But, you know, it's been so long since they cut any teeth, they forget what it's all about. But you even get it when you're cutting wisdom teeth. And the Oragel does help.
Okay, great. Well, wonderful. Thanks for the insights, Dr. Limongelli.
You're welcome.